tonight. I hope that you're doing great and you're drinking lots of water. Why would I say that? Well, it's hot out. But not only that, the subject at hand is about our urinary health, and we need to flush our body with water and other liquids to make sure that the impurities go through our body. I did talk once to a urologist who she said that you don't necessarily have to drink just water, but water tends to be pure. I filter my water, but you might want to use something else. But the only thing I do highly recommend is be very careful of your sugar content. So soda is not going to help you at all. So I want to share a few things, but my disclaimer is a reminder. I am not a doctor. I'm not a clinician. I am not one who treats this for patients. You need to make sure you have a connection with your primary care, a urologist, a GYN, like I mentioned, so that you can be properly treated, but also properly diagnosed. So UTI can affect any part of the urinary system. It includes the urethra, the bladder, the ureters, and kidneys. Generally speaking, it starts with the urethra and the bladder, and it can be treated pretty quickly if you get it taken care of. And sometimes the symptoms that you get are pretty clear that you need to go see the doctor. Common symptoms associated with UTIs include a burning sensation when you urinate, frequent and intense urges to urinate, so you might find yourself going back and forth a lot, cloudy, dark, or bloody urine, fever or fatigue, pain in your pelvis, your lower abdomen, or back. Now, will these all occur? Not necessarily. So, like the burning sensation comes towards the end when it's actually really, really inflamed. For me, I'll get pain in my pelvis or in my back. I'll have fatigue. I never get a fever with it. And let's see, the urine changes and the frequency. That's fun. Why I want to share this is I have had chronic UTIs. I'm not really proud of this, and I have hesitated on sharing this because I'm not proud of it. I'm actually quite embarrassed. Yet the truth is many, many women and men suffer from UTIs. Maybe when you're young you might have one, when you're pregnant you might have a few more. And what happens is over time your body changes. Yay us! You get into perimenopause, you go into menopause, you might have some other things going on in your body that are the root cause of why you might have UTIs. They can be treated with antibiotics, and like I said, the infection recurrence is very common. It doesn't mean that sometimes you might get one and you'll never have another one. But sometimes they keep coming back. Maybe you'll have one once a year, twice a year, or you might have them chronically like I have experienced. What's more, the overuse of antibiotics can have a long-term negative effect, such as damage to the normal, healthy bacteria in your urinary tract and possibly contribute to the development of antibiotic-resistant strains of bacteria. And I've been on antibiotics because I was on 4 years with the Lyme disease. And even when I got off that, I was still getting UTIs. So over the last couple of years, I have really been trying to do different things. I've researched and I've got, okay, this herb should work, this herb, and I've tried it. And sometimes I'll have relief for a couple of months, and then I'll get them back, and then I'm back getting a culture done. So let's see. And when I go now, how many years ago did I do it? Maybe 6-8 years ago. I ended up buying some Regent strips. This is the Mission brand. And I use these because I don't use them until I know that I got a full-fledged thing going on, or I might kind of just say, how far along is this baby? The reason I can say that is because I've been dealing with them long enough that I know that, hey, this is a UTI. One of the other key things that it doesn't tell you here is because of the pain and the discomfort, you can get kind of grumpy. So I try not to, but sometimes I find myself snapping at my husband, and then I'll just tell him, I'm really sorry, I am dealing with a lot of pain. And he knows right then, and I just tell him, I think this is what it is. And then what I do is I just do one of these Regent strips, and I said, okay, maybe I need to go to the lab, drop off some urine, and then get that tested and cultured. Now this is all with communication with my doctor, And what you can do is you can do the same thing. When you are dealing with that kind of pain and you've never experienced it before, there's many causes, and your doctor can talk to you about it. You want to make sure that you get that care the first time. Please don't go to the drugstore because somebody says, oh, that's a UTI, you should use this particular product. And I understand why they're saying that, but if they're not a physician, if they're not a naturalist, if they're not this, this, and this, you really need to listen to your body as well as communicate with your physician so that you can come to the point where you understand your body and the symptoms, and eventually, yay me, you can kind of tell when this is happening. I would like to believe that maybe you can prevent them without having to have all that I've gone through. Now, there's a lot of women that deal with this all the time, and this is why I decided get over my pride and share this, because I think there's other women that would like to know some information. If you suspect that you have a UTI, it's important to consult your healthcare provider as soon as possible. What may start as a mild infection can quickly become serious and potentially fatal if left untreated for too long. Can you get rid of a UTI naturally at home, or do you need antibiotics? I think that is all relative. I think we can do prevention, and I've got some stuff that seems to be working, but that doesn't mean just because I have natural means that I don't actually go and get on an antibiotic when it's absolutely necessary. And the reason that is because some of these can work with the E. coli, which is most common for UTIs. But that doesn't mean that E. coli is the bacterium that is causing your UTI. So that's why I cannot reiterate enough. Please see a healthcare provider and talk to them. If you get chronic ones, they'll set it up so that you can get your cultures done more frequently as you need them. You can sometimes get rid of a UTI naturally by resting. I'm not a rester. I might take a nap, but I have not found that to get rid of it. But that's what the literature online says. But drinking lots of water. For some people, flushing it out of their system, it works. Especially if you've been out and about and you haven't been drinking your water and stuff. That could be just what you need to get rid of it. Taking dietary supplements and giving the infection some time to heal. Somewhere between 25% and 42% of UTIs resolve naturally without the use of antibiotics. And that's why what I'm sharing today are some options, but that does not mean this will work for you. And this might work for me for 4 or 6 months, but that 6 months something might happen and I might have to be getting treatment again. I would rather go every 6 months instead of every 4 weeks, so that's a good thing. There are some situations where wait and see just isn't an acceptable approach. Untreated UTIs can cause potentially life-threatening complications, including sepsis. Now, I never knew about sepsis until I started doing this, and then my nurse called me and told me, and she just explained a few things to me, and I'm like, that's scary. And then I made the mistake of telling my husband, and now anytime he's like, he panics. I guess he doesn't want me to get sepsis. So yes, UTIs can spread to your kidneys, and that's what you want to prevent. And that's why when you have the lower urinary tract symptoms, that's when you want to get the testing done. And they can potentially damage your kidney. That's the other thing. If you have the following signs of a kidney infection, seek immediate medical care. Treatment: fever of 100.4 or above, chills, pain in your back or sides, agitation and restlessness, and confusion. Agitation comes with the other ones for me, and it's because it's uncomfortable. So one of the things that is very common today that is being mentioned to everybody who is dealing with them is to use D-mannose. It's a natural supplement, and they make it, and you can get it over the counter, but make sure you are getting a quality brand D-mannose. Now, I've tried D-mannose. I've tried different ones. I've got one that I have to leave in the refrigerator that I have a doctor, I can't think, she's a naturalist, and she gave me a brand that keep in the refrigerator. Again, it's one that's manufactured, so I kind of hesitate. But I do have it. It has not stopped my UTIs. But I take it as a preventative type thing where I might use it 2 to 3 days a week, and I put that in my yogurt. So that is something that you can try. Now, what I'm doing, some other things with D-mannose, you can get it in some of your fruit. Now, I know, don't eat sugar, because you really shouldn't consume your white sugars and anything that's processed with sugar. Now get this. D-mannose is in blueberries, it's in cranberries, it's in apples, peaches, and oranges. Now, I don't do well with oranges. I like them once in a while, but I'm not an orange person. Broccoli and green beans are an additional source of D-mannose. These are some foods, if you are not eating these type of foods in your diet, consider putting them in to potentially help. Does it mean it's always going to help? No. But why not, if you're not doing any of this, why not continue it? Now, blueberries are seasonal here, and sometimes I have a bunch in my freezer where I'll make a fruit smoothie and stuff like that. But I don't have them every day. Peaches I don't eat every day either. Apples, during the fall, I eat apples almost every day. So there are some things that you can incorporate into your diet that might help instead of you having to buy a supplement. Wouldn't you rather use nature and make sure you're getting organic food? I'm really kind of into that. Now let me see if there's some other things before I share what I do. So what I have done over the last couple of years as I've been fighting this on my own, because I don't want to be on antibiotics. And my physician knows that I do this. He doesn't know what herbs I'm using right now. So what I did was I have come up with something that is helping me. And I'm kind of excited. And like I said, I've been kind of hesitant in sharing because I want those who are trying to do this naturally that you take it a little bit at a time. And the reason I'm saying that is you might be allergic to some of these herbs that I'm about to share with you. So the best thing to do is to know which herbs you can handle. And if you can handle 4 of these, put them together as a tea blend that you can use. So I've got, I'm going to start doing this. This is what I did about 3-4 weeks ago. I made the tea. I take a half-gallon canning jar. You don't have to use ball. You can use whatever. You can't get these half the time. And the cheapest place is Walmart, but they never have them in stock. But you can go to hardware stores and stuff like that, and they generally have them. A couple dollars more for the 6-pack, but this is what I use to make my tea. And what I did recently, I know I have one right here. I thought I took it out. I have 2 of them, so it's probably sitting here. So I have this lovely tea strainer. The cover comes off. Cool. How cool is that? So what I'm going to use is oregano. Oregano is a natural antibiotic. Now it says in 2012 a study evaluated the antibacterial activity of oregano oil. Researchers found that oregano was active against all the clinical strains of bacteria that were tested, and it successfully inhibited the growth of E. coli, the bacteria most commonly seen in UTIs. Isn't that cool? Now, you might not be able to handle oregano, and you might be asking, well, if I have Italian food all the time and I'll just put extra oregano in, do whatever, floats your boat. You want to try to get these herbs in. If you're not a tea person, that might be an option for you, but I can't tell you it's going to work. Maybe you can put oregano in Greek yogurt, plain Greek yogurt. And that's another thing. If you're using yogurt and you're putting in D-mannose, and that's what I use plain, no flavors, no sugar. You can get plain Greek yogurt without all that other stuff. Because when you start eating yogurt with the sugar, then you're defeating the purpose of why you're using those probiotics that are in a yogurt. So always go for a pure, nice, no sugar, plain Greek yogurt, and that seems to work. And actually with me having dairy allergies, I can handle that yogurt. And if I want to have a sweetener, I just put in some of the berries that I preserve, or something of that sort, just to kind of sweeten it up and make it like a dessert type thing. So that is pretty good. So I got some oregano here, and we'll be putting that into the thing. Corn silk. This has been a godsend for me. Now, last year I started drying my corn silk, and we eat corn on the cob a couple times a year. But last year I bought a bunch, and I canned up some corn so we could have it throughout the winter. And then I saved the corn silk. And this year I bought a couple dozen, and I saved the corn silk. And this does wonders for UTI. All right, so it has some, I want you to hear these words, some antibacterial properties. It is also helpful for treating urinary tract infections, as well as alleviating inflammation in the urethra and bladder. That's where all that pain is coming from. You have an infection, it gets inflamed and everything, and then it causes pain. So I started using this, and it's been helping. Another one that is not common. Now this you can get in your when you purchase corn on the cob or when you grow it. Oregano you can grow. You can make your own oregano leaf, or you can go to a natural food store and get that. The next one, the oregano I grow, the corn silk I dried. Let's see, the next one is uva ursi. I love that name, and I'm probably saying it wrong, but it's UVA URSI. Now this is an antibacterial effective on E. coli, most common bacterial that causes UTIs. So I haven't been using this a lot. I've used it in the past, and then I kind of gave up because, as I mentioned, when I first started treating these on my own, I was only using maybe 2 herbs or something, maybe 3. And so I stopped, but I kept it on hand because, you know what, I might be able to use it. So this is going into my blend, and it went into my blend the other day. The other one is garlic. Now I am not putting garlic into my tea because every morning I take a clove of garlic that has been infused in honey that has been here in New Hampshire. So every morning I will get up and I'll have a spoon of that. And during this flu viral season that we're entering, I will have 2 to 4 spoons of this. This will not hurt you. Honey is a natural sugar, so do not fear nature's gift of sugar through honey. It's awesome stuff. The only thing I do recommend is be very, very careful of the honeys you purchase in the grocery stores, because they may say it's all honey, but make sure you know where that product is processed. Let's see. Another thing about garlic. One of the things with bacterium is it gets a biofilm around it. It's like a protective coating. Garlic has a tendency to break that coating down a little bit. They've done studies about that. So because it helps with the viral stuff and everything else, I'm just going to keep taking it. How's that? E. coli that causes UTIs is known to form biofilms that enable bacteria to avoid attacks from our immune system. Our immune system needs to attack all the bacteria that comes into our bodies. And it resists antibiotics, and therefore becoming the source of persistent chronic infection, whether it's UTIs or whether it's Lyme disease or any other type of infection that is caused by bacterium. Fighting a chronic infection without destroying the biofilms is impossible, it seems. And the stevia also helps with mine as well. Now another one is, let's see, is that one? One of my favorites I do grow is the chamomile. I use chamomile in a lot of things. I shared with you how I do my headache with bee balm and chamomile. I use chamomile in this. And the reason is it allows your urinary tract to flush out some stuff, but it also calms that inflammation. And it also slows down those spasms that cause you to have to go to the bathroom frequently. It's a weak diuretic and contains plant compounds with anti-inflammatory and antibacterial properties. These features are thought to help reduce inflammation inhibit bacterial growth, and flush the urinary tract of infectious bacteria, but more research is needed. Of course, anything that has to do with herbs and stuff, they are going to tell you that it needs more research because the money isn't in herbal medicine. It is in the pharmaceuticals, and I'm not ditching them. I'm just saying the money is in pharmaceuticals. And I just find that, if something's working, that has to be my research because if it's working for me, then why wouldn't I use it? You want to make sure that your herbs that you're getting, if you cannot grow it, there's nothing wrong with you not being able to grow it. You can get these herbs at a natural foods store near you. They usually carry these things, and if they don't, I know that one of ours in town, both of them that are in town, they will order them for you. And sometimes if you want them in bulk, they'll get them in bulk, but there's other options online that you can get them in bulk. So let's see, the chamomile I grow, the oregano, corn silk. The next one I have is dandelion root. Dandelion root is, I know I wrote that one down, I don't see it right here. Well, dandelion root, I think I put it on the back. This one helps with the kidney, it helps with inflammation, and it's a diuretic. That's why I have it. Have I been putting it in my tea lately? No. I'm sharing about dandelion root because if you don't have all of these, but you have that, because you harvested dandelion root, and now's the time to harvest your dandelion root if you haven't done so already. You use the dandelions in the spring and you use their leaves for salad, but in the fall, that's the time to get your roots because they're longer and deeper, clean them off and dry them, and that's the best, but you can still harvest in the spring. They're still fine. I've gotten really large roots in the spring. I harvest my own, and I also order some just to make sure I have plenty of dandelion root on hand. Now another thing that is Padaco. This is what I've used for a while. This is one that I used to use with the dandelion and something else. So those alone didn't work, but this one helps with candida and yeast, which can be a side effect of antibiotics and stuff like that. So that's why I have Padaco on hand. It helps with pain and inflammation, and it helps with bladder and prostate infections, which includes UTIs. And there's some other things here. But that's why I have this on hand that I like. So another thing, mint leaves. I've been harvesting my mint. If anybody grows mint, you know that it just grows and grows, and eventually it'll take over your yard. So I have some that were in there. Still smells amazing. Mint has antibacteria against various UTI-causing bacteria like E. coli. Certain compounds found in mint leaves may also help reduce bacterial resistance to antibiotic medications. I want to reiterate, I am not saying don't go get an antibiotic because I think they are effective. And if you are just trying to treat everything with herbs and it's not going away, then you might need to find out what bacterium is causing your infection to keep going on and on and on. I don't drink this tea every day all the time. When I get the symptoms, I drink the tea for 2 to 3 days. That's usually the treatment for antibiotics. And sometimes it's longer. Mine have been longer because they're chronically being returned. I keep getting them. But I'm trying to avoid having to go get the testing done and avoid having to see my doctor or just connecting with him to get the treatment. So I'm doing my best. And sometimes it works, and then once in a while, I might not be fighting the right one. I mentioned about uva ursi. And let's see, the mint leaves and parsley and chamomile. I've already talked about chamomile, that it can be calming. I don't have any, I have some parsley, but I didn't get very much this year, so I have my canister of parsley. Yes, you can get your parsley over the counter, at your grocery store. You can get some of these herbs at your grocery store. So that's why I wanted to show you that I have some parsley. Usually I use this in my Italian dishes and stuff, but you can get that, your oregano. You can get oregano at your grocery store. Honey, you can. But I don't know if you can get chamomile at the regular grocery store, but your oregano leaf and your parsley, you can. And so those are things that you can put into this. And if you're eating corn on the cob, save those silks, and then that'll be good. Now, parsley has a mild diuretic effect, which is supposed to help flush the UTI-causing bacteria out of the urinary tract. They say there's a case study that found that with a combination of parsley tea, garlic, and cranberry extract, it helped to prevent a UTI recurrence in women with chronic UTIs. I don't know. I just started using parsley, to be honest with you. However, more research is needed. And I think you need to determine, do you want to put in it? There's a lot of evidence of how these herbs can be beneficial. It's not just in seasoning, but it can be other benefits. And like parsley, the chamomile possesses a weak diuretic, meaning it's not going to make you want to pee all day. Okay? And that's the problem, is when you have a UTI, you're already going in a lot. And if you have an overactive bladder, you don't want to be going all the time. So it has a weak diuretic effect and contains plant compounds with anti-inflammatory and antibacterial properties. These are thought to help reduce inflammation, inhibit bacterial growth, and flush the urinary tract of infections like the bacteria, but more research is needed. I have to say that because it's true. And not all of these things are going to benefit everybody the same. It's like an antibiotic might work for me on one thing, but it might not work for somebody else. More so if you are one who has sensitivities. And I have a lot of sensitivities to various medications. So it's just one of those things I try to be careful of. So how do I make my tea blend? I kind of like say, what do I want in my tea? And I am going to put a little bit of, this is about a cup size, all right? And I bought this online, and I'm just going to put maybe a couple tablespoons of uva ursi. Today that's what I'm going to use. Definitely the corn silk, because I felt that it worked. Now, why did I share so many with you? Because you know what? If you don't have one, maybe you have another that might work for you. So I'm putting a handful, my corn silk in there, and it will make a mess of that tea strainer, but not a big deal. All right, I got that in there. I am going to put chamomile in because I used this the other day and I think it worked out great. So I'm going to put 2 little handfuls into this. Plus, I like chamomile tea straight too. So I got that. I'm going to do oregano leaf. This is probably about a tablespoon measure, so I'm going to put that in there. Actually, I'm going to put 2. And I'm not showing you this, am I? I'm going to turn the camera. Sorry about that. I didn't show you sooner. And then I am going to put some parsley in here. That might be about 2 tablespoons. Now, this seems like an awful lot. I realize that. But it's also going to make a half-gallon tea. And that's what we got to keep in mind. I also want to throw in some of my dry mint leaves. I don't have to crush these because it's just going to seep in the water. I'm going to turn the water on while we're doing this. I got both tea kettles up on the stove to make sure I have plenty of water. And I'm going to I think I'm going to do 2 things of mint. I got plenty out there to still harvest, so I have plenty. Now, is there an exact measurement to this? As you can see, there really isn't. And what you can do is go little by little, trying to figure out what might work best for you. And like I said, you can get a lot of these herbs at your natural health food store. You can order online once you realize, hey, that one works for me. Can you get corn silk online? I have not tried because I've always done my own. Chamomile you can. I'm going to switch this back up. And all I'm going to do with this, I'm going to get a little tighter up here. Okay, that did not go through. I had a different one the other day. Hold on. I think what I'm going to do is, I think I used a smaller one the last time. Got it. This is a brand new one that I think I'm going to try to get another jar that is bigger. Sometimes I like making mistakes online, not really, but it helps you to see that sometimes you have to work around and see what else you can do to make this all work. Now you can put this in like a cotton, you can make a cotton tea bag. You can do it that way. And it'll do the same thing. You just want to make sure that the herbs get in there for like, this is a large amount, so I'm going to let it go for 10 minutes. And you don't necessarily want it burning, boiling. Because you don't want to break your glass. I don't know if you can see. I'm going to change this a little bit. And remember that this is going down into it, so that herbs will be heated up. Sorry, I can't talk and do two things at once, obviously. And holding this left-handed, I'm not a left-handed person, so this is really quite interesting. I'm starting to shake a little. I guess this tea kettle might be enough. I wasn't sure if it would be or not. And you can see, I'm not sure if you can see it, but it's all starting to turn yellow. Taking in the color from the corn silk and the chamomile. Chamomile tends to turn things yellow. I can't believe I'm standing on my tiptoes here trying to... And I go right up as far as I can. There we go. So that is completely up, and I have a cover for that as well. And we just let that seep. I'm going to let it seep for about 10 minutes. And that was fun. So it's just something, you let it seep for about 10 minutes, and then you can start drinking it. Again, remember to drink plenty of water when you are dealing with the UTI. How long will I drink this? This will come out, the strainer will come out when it's all done. And then, I'm sorry, sometimes this light can be too much. So I will be drinking this tea over the next couple of days. And the only reason I'm starting it is because I did do a Regent strip today, And I'm like, it's just on the start. If I can prevent it from going full-fledged, that's my goal. And why do I get them? We don't know why. The doctor has shared that my age, and there's a few other factors that might be a little personal, but we all have reasons as to why these things can occur. And the best thing for us to do is to take care of our bodies. So, friends, all I'm asking that is if you have UTIs, first, consult with your physician. Make sure they're on board with you. And if they're not, and you want to try this, just tell them, I want to try it. Be open with them and tell them that, hey, this is something new for me. I'm tired of being on the antibiotics. This is what I want to do. But please understand, they may say, well, I don't approve. Some of them are fine with you trying stuff because they really don't want you on antibiotics, most of them. But they want you to know that if it doesn't work, make sure you go to see them, because you don't want it to get so bad that you have a serious kidney infection or it goes into sepsis. That's what you want to prevent. So you will know if it's so bad that this is not working, because the burning pain and a few other things will happen, and you just can't wait for it to get resolved. Now, I know that one of the things said to rest and drink water. And yes, you should rest when you're tired, and you should drink lots and lots of water. But that's not the only thing. If there's a real infection that is serious beyond a simple thing that you can flush out, you need something. So some of the herbs, just to kind of go over it a little bit. Parsley, if you have it, you can use that in place of something else. I use oregano leaves, so you can even use a sprig of oregano. So if you have a plant in your kitchen, just take a sprig out and put that in. Chamomile. I love chamomile. I grow it, and I've been harvesting it all summer, and I love it. So I have plenty, but you can order it. You can go to your health food store, and they usually carry it. Your corn silk, like I said, I don't know if you can get that online or not, but I save all my corn silk, and it's just not the real top part, but I use all the rest that is around it. And you can see that sometimes it's brown, it's usually gold, but it's not a big deal. If you have dandelion root and you've harvested some dandelion root, you can try that. Not many people have Padaco. That's an option. That's why I didn't put it in, because I want people to know that you don't have to have everything. You can just have a few items. So, but that is an option. And uva ursa. Sorry, I have a lot of fun saying that. So my main ones are the corn silk, chamomile, oregano, and parsley. But I always have the garlic. Now, one other thing. I'm not using D-mannose, okay? What I do use is, here I am, a liquid cranberry concentrate. I don't add water to it. There's no sugar. There's it's just regular cane sugar. It is filtered water, cane sugar, or beet sugar, cranberry juice concentrate, and they add in some vitamin C, because they say vitamin C is also helpful. The other thing that I have done and I have used is I make my own cranberry juice from cranberries. In the fall, they're going to be, usually you can get quite a few, so I will buy pounds and pounds of it, and then I'll make my own cranberry juice. And so when I buy this concentrate, it's just a backup for when I can't, if I don't have enough of my own on hand. So, and what I do is, once this is done, I just pour a cup of that, add a little bit of cranberry juice into it, and that's what I'm using. This does not have D-mannose, but they say cranberries do help. When you ask a urologist or a gynecologist or a primary care doctor, whomever you are talking about, there's not a lot of scientific evidence that cranberry juice works, but it does help. It does have those properties, that D-mannose that everybody is a proponent for. So you have to use your own devices, your own thinking process to decide what works best for you. Like I said, there's a lot of herbs that you can use. Using 3 of them should be really good, and add a little bit of cranberry juice, or get some regular cranberries and crush them up, boil them up, and put that in there. I put it in separate because I just want the tea to be separate, and then I add in the cranberry. And again, take garlic every day. A lot of people do not like taking garlic capsules, and it's because it has an aftertaste, and then you feel like you're burping up garlic, or your breath smells like garlic. Not like this. It truly doesn't. I love this stuff. Friends that I've shared this with, they love it. Because you just get your garlic, put it in the jar, cover it with honey, and then you just do a flip, you kind of have it like this for a day, flip it over, and you can flip it a couple times a day until it gets watery like this. And then you don't have to worry about it, and it lasts a long time. Both garlic and the honey work great, and then you can just have that a couple times a day. Will this be your solution for UTIs forever? Like I said, I am getting better at creating a tea, and this is my newest blend, and it worked really well this last time. And so I am just kind of like staying with this. I have something else I can add into it, and I'm hoping that this has been helpful. I know I've kind of rambled a little bit, but it was one of those topics I have waited to share because it's not something I'm proud about, but I also have to realize that there's a lot of people who suffer from this, and they're dealing with a lot of antibiotic use. And a lot of doctors don't really want you on an antibiotic if they can prevent it, but sometimes that's what you need. So if you want to try something like this, like I said, talk to your physician. And you might find that you might get support. Not all physicians will support you. You might not even want to make this stuff. You might want somebody to create little tea bags. That's something that I haven't yet done, but one of the things I want to do is have some tea bags ready so that I can just have it on the go when I'm going to visit somebody. I have one in my back pocket so that I can make that tea, and then when I get home I can have a regular blend of it. So there's all kinds of things that you can do for your urinary health in efforts to prevent the UTIs, but also these are also nutritive to your body as well. So you're not going to do any harm. Can you use these with the antibiotics? Yeah. So if you're on an antibiotic treatment for a bad UTI, it will not hurt you to have these herbs with it. But you need to confirm with your doctor, because what they do is they have a chart. They can say, will corn silk interfere with the antibiotic? Will chamomile interfere with the antibiotic? Will oregano? These type things. And you can find it online as well. So I hope this was helpful, and I'm looking forward to this. 2 more minutes. I'm looking forward to having the tea because I don't have anything major going on. I just noticed there's something not right. So I won't have to drink this 4 to 6 times a day. I'm just going to have a cup tonight, have a couple cups tomorrow, and then the following day I'll probably be done. It looks like it's done here. So I can pour my cup. And that's part of the reason I kept talking. Alright, so I'm going to take this out. Now, because I didn't have it on a rolling boil, the glass jar is not that hot, so you should be able to pick it up. So I'm going to move the camera one more time. Hopefully it's not making a lot of noise. Sometimes I realize these make a lot of noise. And just pour it into your cup. And then what I do is I don't put a lot of cranberry juice in there because this is concentrated, so I don't put a lot in. I just put enough for a little bit of a flavor. Now, one thing that I said you don't have to do, but you can do, you don't have to put the garlic in, but this honey can just do the sweetener instead of doing the stevia that you may not have. Get a spoonful of the garlic infused honey and put that into your tea. let me tell you. I'll drink it in front of you so you know it's not so bad. It's perfect, guys. I can taste the garlic, I can taste the cranberry, and I can taste the oregano and parsley. So it's kind of really cool. And I can smell the chamomile. So I know that I got it all in there. And like I said, there's other herbs that you can use. I hope you took some notes as to what you might be able to use. If I get a chance, I'll try to put them all down below. But that's something. And if this helps you, great. If you've tried some of these before, leave a note below. Share it, because other people might be interested in knowing. And I know it's an embarrassing topic, and truthfully, I've been wanting to share something like this for like a couple of months, but my pride stands in the way, like it does for anybody. But this has been helping me. Like I said, it doesn't mean I won't be on antibiotics, but it does keep me from having to go on them as much so far. So we'll see what happens. And I say so far because the last couple of months I've been using this, and if I get symptoms, I just drink it. So that's good. The longer I go, the better I'll be and the happier I'll be. So I hope this works for you. Folks, I hope you have a great night, and God bless.